Hey, I'm Dr. Joe Niamtu, LoveThatFace.com. I'm a double-boarded cosmetic facial surgeon in Richmond, Virginia. I do surgery from here to here. I don't do boobs, bellies, or butts. I'm a surgeon, I'm an author, and I'm a teacher. I have almost 25 million views on my YouTube channel, so please subscribe and like us. And one of the viewers asked me to do a little video on bone tunnels for fixation for brow lifting, specifically endoscopic brow or non-endoscopic brow. So I'm going to talk about this. If you've never done bone tunnels and drilled a hole in the skull, it's a little intimidating, but it's really not that hard if you know your anatomy and you have the experience. So when we drill burr holes in the skull for tunnels, okay, if you are kind of in the paramedian region, as you'll see in this picture, the bone is anywhere from 4 to 11 millimeters thick, so it's pretty safe when you're just going through the outer table, okay? And bone tunnels are great because they're inexpensive, okay? You don't need a lot of fancy equipment. You're not putting any clips or foreign body type things there. And there's a lot of ways to do suspension, but bone tunnels are a very popular way, and I'm going to show you exactly how I do it with two different drills, so stick around. So this is our micro air hand drill. Very efficient. It has a 3-to-1 gear ratio, so for every a third of a turn here, you do a full turn on the burr. And what we're going to do
what we're doing
here
is drilling a dimple here so that when we start going lateral, we have a tunnel. So we're just drilling.
we put on, you can use a lot of different drills, but we put on a self-limiting 5 millimeter drill. And we're going to start going into the actual tunnel. Very, very simple to do, just a twist of your fingers, okay? And now we're on the other side here, and we're going to join these two holes. And you can tell when your holes are joined if you can run water. I'm backing out now. If you can run water from one hole to the other, and let's see if we can do that. No, so we're not through yet, so we're going to go back and go through each hole again. So I'm going to back out, which is a nice thing about this screwdriver. And now you can see that we have water going through both holes, so our bone tunnel is complete. It really just takes a minute to do that. So what we're going to do is put a pull-through suture here. And so we're going to do this, and that's going to pull through our bigger stick. Sometimes it's hard to pass. I use 2 sutures to suspend this, and sometimes it's hard to pass them through. This is a little 30-cent dental floss threader, and so you can feed both of your sutures through here, and then simply grab this and pull them through, okay? And so this is the floss threader, and now we have our 2 sutures, and we colored one suture with a marking pen just because sometimes it could be confusing what's what and what goes where. So that's just a little trick there. Put a mattress suture through here, and that's the blue suture, okay? And this is the white suture. Remember, these are both going through the burr holes, and we'll space this a little bit differently, but this is our elevation line where we want our maximum elevation, which is usually between the middle and lateral thirds of the brow. We want to pull a little bit laterally as well. Okay. All right, and it's really pushing up on the brow, and this will be our first suture. And I found out over the years that when I used one suture, sometimes I just had a little bit of post-operative change. So we're going to use 2 sutures here. Makes it a little bit more cumbersome. Let go here a second now. And that brow is suspended just where we want it. And when you're laying down, it's usually well suspended. Okay, and here is our other suture. So let's do this. Let's cut excess off right below my instrument there.
Okay, hold that. And let's push that back again. Once again, all right, get any hair out of it. All right. Cut it. And these are 2 of Vicryl sutures, okay? And give me a pickup and blot this. And do you have a staple? Well, actually, we're going to put a sub-Q suture in it and then come back. This is a striker, battery-operated drill, forward and reverse, and we use this for implants. And this is a, again, that 5mm guarded burr, and we're doing the same thing. I've already drilled the hole on the other side. Okay, and now you can see we have water flow through the hole. So, and again, I drilled that side already, so you only saw one side being drilled. So these are 2 really convenient ways to use both. Put a subcuticular suture in, and these are 4-0 gut sutures, and some people like to use staples. And, you know, we used to use vertical incisions way up here, but I think the bone tunnels work better with horizontal incisions, and these heal really well. So we'll put a couple more sutures in and we're done.
Hey, I'm Dr. Joe Niamtu, LoveThatFace.com, and I want to talk about the newest release on my video series, which is Deep Plane Face and Neck Lift. This particular topic is a lecture and 4K videos, 2.5 hours worth of step-by-step process for deep plane face and neck lift. I have a lot of other titles which I'm not going to read to you, but I'll show you here. And what I have done is filmed in 4K, step-by-step narrated instructions while we're actually doing surgery. And it's a great way to learn cosmetic facial surgery for beginners, or a great review for experienced doctors. So take a peek at these titles, and if you're interested, you can preview or purchase them at cosmeticsurgeryeducation.com. I'm Dr. Joe Niamtu. Thanks for your time.